Okay, hi everybody. Thanks very much for joining this afternoon. My name's James Brown. I'm the Senior Product Specialist for Arden SystmOne. And I'm going to take you through a bit of an overview, just an introduction really to what Ardens is all about, or some of the features that you've got available in your clinical system. And hopefully should just give you a bit of a heads up as to what's coming, give you an idea as to how you go about activating it. And of course, every practice will have some on-site training to sort of take you through the toolkit and get you started really. But it's just a first taster. Just a bit of housekeeping just to start with. This is the SystmOne introduction webinar. We are running a simultaneous EMIS introduction webinar for any of the EMIS users. So if we do have any EMIS users on the call at the moment, you can just see on the holding slide on the screen, there's your instructions there on how you can join the EMIS webinar. Okay, so it's just a separate link to join the screen and a separate conference call ID number just down there. So I'll leave that on the screen just for 1 second so you can take a note if we do have any EMIS users on the call. Okay, great. So just got our agenda page open on the screen here. So it's just talking you through the subjects that we're going to cover this afternoon. So I'm going to start off just with a bit of a brief introduction, sort of who we are as a company, where we've come from. Then going to give you an overview of some of the triage tools for clinicians. So a lot of the tools available, the templates available on the system, are designed for your clinicians to use. But I appreciate we've got a lot of practice managers on the webinar today, and really the focus is for you as practice managers, but it's useful for you to get an idea as to sort of some of the tools that are available for your clinicians to use. I'm going to take you through how referrals work through the system, how some of our chronic disease review templates work, how you can access our local enhanced service templates, an overview of the administrative tools for reception and back office, how you can access all of the contract and activity reports, and as a final subject, how you can maximize your quaff income by using Ardens and hopefully identify potentially a fair bit of missed income for your practice, be able to sort of boost your income figures there just by using the toolkit. So a brief introduction to Ardens then. So just a brief bit of background to where we've come from. The company started off in 2013. It was set up by our CEO, who's a GP that practices down in Wiltshire. So that's Dr. Robert Greville-Haygate. Back then he started the company really just as it started to create some templates in SystmOne to help to standardise the way that certain things were done in Wiltshire, where he was working at the time. Over time, just saw the true potential of the clinical system, really, what you could do with it in terms of configuration, if you had enough time that you could invest into that. And as we sort of come up to where we are now, 2019, we're now the largest supplier of a toolkit of this kind for SystmOne users. We've also recently merged with a company formerly known as QMasters, who are now Ardens for EMIS users. We work very closely together, so we deliver an equivalent solution across the two clinical systems. And combined, we have around about 15 to 1600 GP practices across England, all using this toolkit. And it's a great way of standardizing the way that SystmOne and EMIS are used across large areas, which is why your STP have gone down the route of commissioning Ardens for all of their GP services across the STP footprint. So talking practices in Norwich CCG, Great Yarmouth and Waveney, and North, South and West Norfolk CCGs as well. Great, so the next part on our agenda here is the overview of triage tools for clinicians. Now these items on the agenda are hyperlinked, so we have some support videos, some online training videos for each of these topics, so please do have a little look at those. You can click through to those and have a brief sort of video demonstration on each of these topics. But here I'm going to swap into SystmOne now and just basically take you through some of the key tools for your clinicians. So this is logged into SystmOne here. I've got a test patient open. I'm just going to go into that record. So any data that we see in this patient record is purely fictitious. It's all test data just used for demonstration purposes. But essentially when you get going with Ardens, when you activate it, you install the toolkit, and largely access to our data entry templates from within a patient record are controlled with these little icons that appear underneath the patient's name and address. You see my cursor just sort of circling them at the moment. There's a few standard icons that we put on every patient record. So you have a little doctor's bag that takes you to a general consultation tool. That's where we're going to start. That's sort of the triage consultation tools, if you like. We also have a long-term condition management tool. We have a telephone triage template, which is red telephone. And the very last icon we see is a communications template. That's how I get access to all of the referral documents that we make available through the toolkit. Every other icon is triggered by certain things that have already been coded or that are missing out of that patient record. So you'll be used to seeing a lot of these, the little disease register icons. So for example, here my patient's asthmatic. They have a little blue inhaler. They're also diabetic. They have the orange D icon. Those icons are pretty standard in SystmOne, but when you activate Ardens, you in a sense, you install our set, and they take you to the Ardens template specifically for that condition. It's part of the setup guide as well. So when you first activate Ardens, you might see two sets of icons. So you'll see a set of icons that you've always seen up there, the default SystmOne icons, and then you'll see the Ardens set. So a few of those will be duplicated, but as part of the setup guide that we send out, we give you the instructions on how you can deactivate the standard SystmOne icons and therefore sort of remove any duplication. We'll go into the general consultation tool here. This is one for any of your GPs or your nurse practitioners, anybody who sees patients as sort of an acute style consultation or minor illness. So if I click onto there, then we open up a template called General Consultation. And this is just a useful tool that we can use to document all of our consultation narrative, but it serves as a dashboard and a link into lots of the other tools available through Ardens. Now, nothing on the template is mandatory, so it doesn't force anybody to work in a completely different way. You can really just use this as a dashboard and a link into other resources. But actually, the standard fields that your clinicians will be used to filling out during consultation are available on this template as well. So you see here I have a history, an examination box, have diagnosis here, where I can code a diagnosis, and a plan box down here for any sort of text narrative. Now, if your clinicians would prefer to use the standard consultation tool in SystmOne, if I just click Start Consultation, you'll have it open here. They can continue to do that. There's nothing stopping them continuing to use that to document the narrative, and maybe they might just want to dip into the doctor's bag to go on to the other tools, so things like patient diaries, scores, leaflets, formularies, and we'll come on to those in more detail in a second. What we'd like to think is that over time, your clinicians will find that they do dip into this screen more often than not to get access to these other tools. So actually, it just makes far more sense just to jot all of your consultation narrative straight into the one screen. You kind of bypass this consultation screen behind. So history and examination just work as free text boxes. Underneath there, I've got some common numeric codes. So this is just a nice time saver. I don't have to go hunting for numeric codes or opening different templates to go and code that general examination set. Any other examination or numeric fields that I want to complete that aren't immediately available directly on the template, you have a link to vitals and lifestyle here. If I go into there, this just serves as a nice common values template. You'll never be in the scenario where you have to fill in the entire screen here, but it's a nice simple place to hold all of those common things that your clinicians will be jotting into to lots of their consultations. And moving on to some of the bespoke tools here that we've got, the first one to mention really is patient diaries. So this is a really simple concept. If I want to give a patient a diary, this is like a blank formatted sheet that I can print off for a patient. They can take it home and they can start jotting down their symptoms. I can just tick the box to say that I've given a diary, click the word diaries, and then here this opens up a little library of them. So here I've got a general symptom diary and then alphabetically from allergy down to peak flow. So let's say, for example, I want to give the patient a headache diary. I can just click the word headache diary. It opens up onto the screen there, and then I can just print it with a little button down at the bottom. So we see practices tend to have things like photocopied stock of those diaries, or you have favorites stored on Internet Explorer that you go to favorite websites to go and print those off. We see that as just a quicker route through, having them embedded directly into the clinical system, but also a nice quick way of actually documenting the fact that I've given one, because ticking that box puts a little line of text into my consultation to say that a diary was given. Underneath there, along very similar lines, you've got a whole library of scored assessment tools. So clicking there, now you may have a few of these in practice already. Practices certainly have things like usually a PHQ-9. They might have something like a Wells criteria for DVT, but this is a library of all of them. And as part of the ongoing service, we keep this library up to date. So as new scored assessment tools are coming out, we add them to this list and we adjust any that might have changed. If I show you an example of just one of them, here if I click on, say, fever pain is quite a popular, this is like an antibiotic stewardship tool. And the idea is here that I can just answer the questions. It'll calculate the score down here. And then just underneath, I've got the different thresholds. So how to interpret that score, what the different numbers mean, and along with links next to the next logical step. So let's say I've got a very low score like I have here. That's antibiotics not indicated. So I can tick the box. And then the next logical step in this case will be to issue the patient with the RCGP leaflet about whether they're not having antibiotics today. That's just stored as a Word document, just guides me through. So this little intern screen comes up. I press write now, just as if I'm generating a letter. That's all pre-configured for you. You can just you can interact with that, tick the various boxes, print that off for the patient, and of course that's all stored in your consultation narrative as a good audit that that information was given at the time. It's great for CQC as well, so to prove the fact that the record keeping's nice and tight, that you're storing copies of all of this patient information that you're giving out. Good. Now all of the rest of the scores work in the same way here. At the moment, I'm just using the General tab. So the General tab is the first tab that opens when I click on the little doctor's bag icon. But you've probably already noticed you've got more specific tabs along the top. So what we encourage our clinicians to do is to select the more specific tab once they get an idea of the presenting complaint the patient's coming in with. And that just means that the template then just focuses to that scenario. It gets a little bit more specific. So instead of getting a link to all of my scores and then going to search for the fever pain score, I've got direct links to the scores that are going to be most useful in that scenario. The other added little benefits that you get through selecting one of the more specific tabs is that along the side here, I've got some preset options. So where I have a free text area to document my history and my examination, I can actually click on the little preset notepad there, and I can just select from this list. So I can select one or two of these lines of text to give me a really good starting point for my narrative. From there, I can just click next to it. I can carry on typing. I can delete as appropriate. Or actually, I don't have to use that feature at all. What many of our clinicians have said in the past is that some prefer to actually just type that history and that examination and tailor it exactly to each patient. It's completely up to you. There's no set way of using it, but they're useful features there designed to really just save you a little bit of time. Now, a little bit further down the screen here, I've got links into sort of my usual investigations. So I've got links into my ICE or TQuest or whatever the product is that you use for your electronic requesting. My diagnosis section turns into a simple list of codes here. I can start typing just to select the first sort of code. It starts with a particular letter. Underneath here, I've got some common safety net tick boxes. So just some common lines of text just to say, I've given the patient advice if it worsens no better or any concerns. And I've also got a referral safety net code along with a letter that I can print for the patient for any advice. Now this just highlights an area that we localize within the toolkit. So you'll see lots of things as you start to use it that are actually tailored for your particular CCG. Now if I click on the safety net letter here, I'm based in Wiltshire, so this is just picking up the referral advice Wiltshire letter. I'm just going to cheat slightly and I'm going to choose a template, and I'm just going to swap over to something that's a little bit more relevant for you. So I'm just going to click on the Norfolk and Norwich referral advice letter. But of course, you wouldn't need to complete that step. We do the configuration in the background. That means when you click that letter, it directs you to your localized resource. So there's our referral advice letter. And then here the idea is that I can say to the patient, today I'm referring you to the ENT clinic. If you haven't heard anything about your appointment in 7, 14 or 21 days, then please contact. And here you can drop in the contact number of the service that you're referring to. And it serves sort of two purposes really. It serves as a nice medico-legal audit that I've given the relevant advice to the patient, but also it helps to stop the phone traffic coming back through the surgery for any patients chasing their referrals. They can just go direct to the service as they've got the contact details. I'm just going to cancel out of there, but of course I could just press save final version. That goes into my consultation as well as good audit that was given. Underneath there, I've then got things like patient information leaflets and letters. So just a very quick example, if I wanted to give a patient an information leaflet, I can tick the box for leaflets, press the button for leaflets, and then here I've got a nice library of all of my common leaflets that I might use in that setting. So here, if I want to give a leaflet on hay fever, for example, I can just select from the list, and that will then load patient.co.uk or patient.info now and take me directly to that web page. And of course, I can print from there. Actually, one of the features that our users really like is the fact that these templates lend themselves quite nicely to sending that information electronically to the patient. So instead of clicking the link, loading up the website and printing off a copy, here I can just highlight the text, just like I would do in a Word document. I can then right click and copy. And then down here, I've got a link to launching an email or launching a text message. So actually, if I've already got patient consent for text messages and a mobile number, I can click there. Let's get a nice simple text message box. I can paste that in, click OK. And when I save the record, the patient gets a text message with a link to that leaflet. That not only saves on printing costs, it's also a little bit quicker. You don't have to wait for the web pages to load, but also it's the best way of auditing what information has been given to the patient, because that hyperlink is going to be stored in that record and that consultation forevermore. Also serves as a great way of getting more patients to consent to that service, because if a patient hasn't got consent already recorded in the record, by clicking one of these buttons, it runs a little protocol. So in a sense, it's interrogating the record to see whether there's consent or not. And if there isn't, it asks the clinician to click consent gained or declined. If I click consent gained, it'll then allow me to go through and send an email in this case. It's also prompting me to record the email address for that patient because they don't have one stored in the record already. Now, getting your clinicians to use that and encouraging them to send electronic links to this to information for the patients, getting more and more patients set up for those services just helps you out longer term. So when it comes to bulk mailing campaigns for things like flu campaigns or for long-term condition invites, we give you all of the reports that identify those cohorts of patients, and we split them down by the available contact methods. And actually, a new feature for this year, splitting them down by their preferred contact methods, which is a new push from NHS England to make full use of the preferred contact method if you have one recorded in a patient's record. Such leaflets, you have those on all of the consultation pages. You also have a library of just quick-fire letters. The idea of this is that sometimes it will save your GPs doing it dictation for something that's very common. So on here, you've got things like a Med3 certificate. I can issue one of those. I've got a private sick note. I've also got things like letters on self-certification. So this is quite a popular one. The sick note not needed is less than 7 days. Instead of a GP sometimes wasting a lot of their 10-minute consultation time explaining to a patient why they can't have a Med3, they can just click that icon. They can print off a quick letter, which is just very simple. It's got your surgery details at the top, but the body of the letter is designed really to show the patient's employer. It's to say to reminding the employer that it's a responsibility of employees to self-certificate for 7 days. It's not the GP's responsibility to give that evidence. Of course, those tools are all available to your reception and admin teams as well. So it's certainly not saying that suddenly your GPs are now tasked with doing all of that admin and that correspondence. They do have the option of printing it there and then, but they could just as easily just refer the patient back out to reception and say, ask reception for a letter on self-certification on your way out. Good, and then we're on to things like the formularies as well. So a whole other large part of the toolkit is these interactive formularies. So here, as I'm on the ENT and oral consultation page, just a very straightforward example. If I click sore throat formulary, that'll open up that formulary. The first page is the clinical guidance page. So what's first line, second line medications, any alternatives if the patient's pregnant. I've got another opportunity to use my fever pain score there if I didn't do that before. And actually the window at the bottom gives me a whole set of drug optimizations and best practice alerts. And these are tailored for the patient that you're viewing at the moment. So these are all triggered based on complex clinical reports running in the background automatically. So it's actually telling me that this patient's got their blood tests up to date, but there's a couple of medication alerts. For example, this patient's on 2 or more medications for the same reason. And I can actually just deal with those straight away. So for example here, if I was to right click on the candesartan and click stop, if I go back up to where that medication alert was, you can see it's disappeared in real time. So you get that real-time validation you've done the right thing in the record to satisfy the alerts. And there are thousands of examples of those alerts, but it's great for CQC because you can prove the fact that you deal with them opportunistically, but of course they're all sat in the background of the system that you can run as standalone audits. You can just run that report, find a number of patients that meet that criteria and go and deal with them all in one go. I'll come on to those a little bit later as well. Now, when it actually goes to going ahead and prescribing the product, so let's say I go for second line here, clarithromycin. Let's pretend our patient's got a sensitivity to the first line. So I click on there, and I've then got quick action buttons that generate the prescriptions, all with adjusted doses for different weights. And there's a handy little weight box up at the top. The idea of that is as a reference checker, I can see what the last weight was in the record, and then click the corresponding button to generate the prescription. So it's not only quicker to get to that end point of actually generating the prescription, because all of my different doses are already preset. I just pick from the list rather than editing manually. But it's also great for CQC because, again, you can prove the fact that the latest evidence-based guidelines are being referenced every time I go to prescribe. If any of you have any training practice, have any newly qualified GPs or GP registrars, then this is a really useful tool. You can really sort of be confident that you're giving those colleagues relevant, up-to-date clinical information they can refer to, and it's nice and quick and easy to access. Good. And the other little feature down at the bottom here is you've got the referral criteria. So if I wanted to double check what's the criteria for, say, tonsillectomies, for example, I can just click the referral criteria at the bottom. And again, this is all just plugged into the clinical system. So I get my choice of topics down here. I could select 2-week wait or sinusitis or tonsillitis. Let's click tonsillitis here as an example. And then up comes the referral criteria for those procedures. And here I can go through the list and just select what criteria the patient meets. And you can see my options quite interactive at the bottom. As soon as a patient meets any of the criteria, I can then tick criteria has been met and the referral has been made. And of course, we hold all of your referral documents as well in a nice, easy way to access. So what I'll do just very quickly now is just come out of the consultation template and just to highlight that actually under the auto consultation menu here, if I click on the auto consultation button, which is just above my consultation window, I then have a library of all of our consultation templates. So actually that one that we've just run through is just it's an acute style sort of triage, minor illness style consultation. But actually if I click on that button, auto consultation, I've got menus of more specific consultation templates. So there are loads of templates in here, and it's just really a familiarization exercise really as to what's available, what I use in different scenarios. And of course, we tackle that during sort of your training, and your CCG training team are going to be coming out and working with each practice to give you a bit of an idea as to how you navigate everything. Great. Now, if I just come back to our agenda here, the next little item on our agenda is just to cover how we do referrals within Ardens. So hopefully it gives you a taster of the triage tools for clinicians. But here, if I cover referrals next, I'm just going to dip back into SystmOne here. Now, every referral document that we're hosting for you, we put on this little orange arrow, which is the very last icon that you see underneath any patient's name and address. If I just click on there. Now I've got an example here for Communications Norwich. Obviously we localize that for each of your CCGs. So apologize if you're not a Norwich practice, but this is just my example. It works in the same way. So if you're part of another CCG, you click the orange arrow, it takes you to a localized screen for your area. Down here you can see we've got all different types of referrals. So if I click on 2-week wait, I've got all my 2-week wait referrals here. If I go to the referral directory there, just an example A to N, lots and lots of your community referrals and different types of referrals there. Just serves as a main sort of springboard to find your relevant form, and from here you can just click on it to load it. Now what I'm going to do is I'm just going to clear down everything that we've done just very quickly and just pop back into the record. I'm just going to give you a really quick example that if the consultation has been captured as we went through it just before, that your referral documents give you a much better starting place for your referral. So here, as my example, I'm just going to do a quick 2-week wait breast consultation. So I've got my doctor's bag icon there, general consultation. I selected breast. Here I'm just going to pop in some detail. So I'm going to say it's a breast lump. It's here. The diagnosis is suspected breast cancer. I can pop on my safety netting. And of course, just as a recap, I can reference my referral criteria down here. And in this case, let's say it's 2-week wait, and there it all is. So actually, once you know your way around the toolkit, you get used to that general layout. It's a really quick system to navigate. I've got all of those tools and points of reference material just at my fingertips. So that will be my consultation done. Just to give you a quick example, I'm going to go into the tab journal here just so you can see the structure, how that looks. So it looks a little bit different than your sort of standard consultation that you've been recording in SystmOne, but along very similar lines. You've still got this HEDP structure for your history examination, diagnosis and plan. Anything else that I've added into the template is nice and clear on there, including things like the medical drawing that I've dropped into my template. So going ahead and doing the referral now, I'd click the orange arrow. Up comes my communications template. In this case, I'm doing a 2-week wait, so I can just click that option, and then I can select the breast form here from the East of England forms. Press write now, and that'll just load the Word document, and it will merge in anything from the record that SystmOne can do. So all of the demographic details and some of the clinical details you'd expect, things like problem headings, current list of medication, latest blood test results, etc. But actually all of the consultation narrative and the medical drawing that I've done through the template will be automatically brought through to the form. Now, if you just bear with me just 1 second, a little bit of a, there we go. Up comes the form. You can see here, everything's merged. If I start to sort of scroll down the form, you see the little bespoke bit. So there's my medical drawing that I did. If I scroll down a little bit more to the reason for referral box in the summary, that's all of the narrative and all of the options that I've selected from the template. So it avoids quite as much copying and pasting. It's actually a really good way of reducing the amount of dictation that you're doing. And actually, we've got a lot of practices that have completely done away with the digital dictation, and they just merge in the consultation and just send very straightforward instructions over to the admin team in terms of any sort of other content that needs to be added. From here, if I'm sending that over to my admin team, I typically click on Save for Future Editing. That gives my admin team the option of going in there and tidying anything up or adding anything before it's sent. And then down here, my step 2 is what do I want to do with that referral, either task admin to do the choose and book side, or I can actually click on new choose and book now and attach the letter there and then. It supports both ways of working. It's completely up to you in terms of what you do already. But I think the most common option really is to click on task admin to do the choose and book referral, and it automatically loads a task directed to the right group, already labeled needs choose and book referral, and that just basically adds to the work list. I don't really need to type anything in there. I can just click OK just to send that message. Good stuff. Now all of those referral templates, if I just pop back into the orange arrow again and just to show you the structure again, we keep this up to date as part of the ongoing service. So we work closely with your CCGs and your STP, and when a referral letter changes, someone at your CCG tells us that that has changed, we update that on the one template, and everybody then gets that change automatically. So it works nice and quickly, and we put some information down at the bottom of the communications template as to who your point of contact is if you wanted to question any of your referrals. So you can question them with your CCG contact, and then if it means that it's an out-of-date form or that any form needs adding, they'll then contact us, and we get that put into the system nice and quickly. Great. Now I'm just going to pop back to our agenda. And the next little item on our agenda here is an overview of the chronic disease review templates. So we've covered a little bit of sort of GP, ANP type functionality. We'll cover a lot more of some of the nurses functionality now for the chronic disease reviews. But again, just popping back into SystmOne and using this test patient as our example. The chronic disease review templates are nice and quickly accessed with the disease register icons that appear under the name and address. So again, if my patient's already diagnosed, they sit on a register already, then they'll have an icon triggered. And this happens just by default with SystmOne. You'll be used to seeing those icons already. Once you activate ARDENS, they all then get linked to our data entry templates rather than the standard GMS contract template that SystmOne give you each year. And here, as an example, if I click on the blue inhaler to take you to the asthma template, takes you in here, takes me directly to the review tab. You can see I've got tabs along the top here. So there's different templates or different tabs for different scenarios of what I want to be doing when it comes to asthma. So if I was diagnosing the condition, I can click the diagnosis tab. It gives me all of the diagnostic criteria and the opportunity to then add a diagnosis code on. My patient's already diagnosed, so the most common use for that template is going to be the annual review. So your nurses can come in here, they can use this template to capture any of their review information, and it should be a nice straightforward sort of logical pathway through all of the information that's required for review, and it covers all bases. It covers your contractual requirements for QOF and any local enhanced services, but everything else on the template is all part of best practice guidance. And again, there's nothing mandatory on the screen. We use a starring system to indicate the important codes. So red stars here are my QoF requirements, and yellow stars are my local enhanced service requirements, or just a useful performance measure. It essentially tells you that there are links to activity reports that I can run and drill into the quality of my asthma reviews. But nothing's mandatory, so I don't have to record anything more or less than what I'm doing already, but everything on that template is all part of the latest best practice guidelines. So it serves as a nice quick way of just running through that review and capturing everything. It works nice and simply from here. So they just drop down a list of codes. I can put my asthma review code. I can pop on a smoking status there. Let's say that they're a smoker and I've given smoking cessation advice. Now to the right of those fields, so these little tools down the right-hand side are like additional information for the field that I've just recorded. So in the case of smoking here, I've got my basic fields, my smoking status and my smoking advice code. Then if I want to record any more information on the smoking, I just click the smoking icon. That opens up a dedicated smoking template where I can go in and use things like the smoker life expectancy calculators. I can record whether the patient uses an e-cigarette, whether they're a passive smoker, whether a user of cannabis. I've also got links to information leaflets around smoking and some more detailed information about the advice and onward referral. There's another example when it comes down to things like anything to do with medication. So for the bronchodilator use section here, I can say whether the patient uses here. I've then got a link to the asthma formulary. So not to say that this is useful for all of your nurses. You may have non-prescribing nurses that are doing your asthma reviews, but actually even for your non-prescribing nurses, it's quite a useful point of reference. So if I click on the asthma formulary, it gives me the detailed pathway of the pathway through those medications. And if I select one here, it gives me an idea as to what these products look like, the different adjusted doses, what's most cost effective. And that can be quite a useful tool when you get that scenario if the patient says to you, I used to take the purple inhaler, and you're sort of struggling to think which purple inhaler, and there are quite a few choices of that colour. And you can use the template literally just to flick between the tabs and get an idea as to what the patient might be talking about, whether it's sort of this circular device here or the pump. Of course, if I am a prescribing nurse, now I want to go ahead and issue a new prescriber, a new inhaler, I can just prescribe here just by clicking the buttons. That'll generate the prescription. We've also got a couple of things on here, like the relevant diaries. We touched on diaries earlier for the GP's tools, but linked is all your associated diaries on the review templates. There's a peak flow diary here. A little bit lower, I've got things like inhaler technique. So when it comes to documenting the inhaler technique, let's say it was moderate or poor, I could then click on the inhaler technique button, and this works just like the leaflet does. There's links to YouTube videos on how to use everything properly. And again, and of course here I can just copy that hyperlink, and I can just send a text message and paste that into the box and say to the patient, have a look at that YouTube video when you get home, and that's all audited in your consultation narrative as well. And just finally, at the bottom of your long-term condition templates are the associated care plans. So we use Word documents as care plans. You have a care plan on all of your relevant templates here. I'm just going to show you an example of what that looks like. That comes the asthma care plan. I've got that national care plan structure there. So the green, amber, red, the advice, what to do. And then over on the second page here, this will actually merge through. It's like a mail merge document. So if my patient is taking any reliever or preventer inhalers, that will automatically merge onto the document, including things like their latest peak flow readings. There's a little symptom diary down there that the patient can use as well. Because I can print that off and save the final version, that becomes part of my consultation and a record that was given at the time. Great. Now, every other long-term condition review template works in exactly the same way. So for just a quick second example, if I click on my diabetes status alert here, up comes the same idea of the template. If I was diagnosing the condition, I've got my diagnostic criteria, different thresholds here to make a diagnosis. Actually, the review laid out in exactly the same way as that asthma review template. So the idea is that once you get used to using one template, you pretty much know where you're going for any other template that you hit. Even if you've never seen it before, it's the same idea. Red stars indicate your QoF requirements, yellow for local enhanced services, and to the right, I've got my tools like my diaries, my formularies, and my care plans. Good. Now coming back onto our agenda, just to pick up the next topic, the local enhanced service templates. So what we do as a part of a localization exercise is that your CCGs send us on your latest copy of the service specification for your local enhanced services. Then we design a set of templates around that. We update the templates that we use for that to make sure that they include the correct codes for your local enhanced service returns. Now, a quick way of getting access to all of those local enhanced service templates is if we click on the auto consultation button. Again, auto consultation serves as my quick menu of all of those templates. Here, if I select Arden's contracts and local enhanced services, this will give me a dashboard of all of the enhanced service templates that we've got available. On here, this serves as a dashboard of all of the enhanced services that we configure for all different areas. But here, if I just give you the example of the Norwich CCG local enhanced service template, so there's a little springboard there, links to the templates on all of your service specification. There's a hyperlink back to your service spec, so if you want to reference it at all, you can click on there. That'll load that up as a document that you can scan through. But actually, if I go to any of these templates, so let's just give you an example of, say, the wound management template. I open that one up. Wound management templates split into lots of specific areas here. So I'm just going to select general to give you an example. But the local enhanced service templates, as we mentioned on the asthma template, they're indicated with a little yellow star. So it's immediately obvious to your staff which is the important code for claims. Essentially, the yellow star is linked to an activity report that I can run, and I can use that to submit my claims. Now, of course, as part of the local enhanced service localization exercise, it's not just the templates, but it's also the supporting reports that we make sure are up to date and available for you as well. So just to highlight where those are, if I go to the reporting menu in SystmOne here and select clinical reporting, down here you can see I've got the Ardens Limited clinical reporting folder open, got lots of different categories, and the one that we're interested in this case, is a contract's current financial year. And you can see here that we split that down by all the different months of the year, the different quarters, and you have an annual folder as well. So I've just got May, current financial year selected. You can see all of the different activity searches in here. Now, this should cover all of your local enhanced services, but also an awful lot more. We also give you all of the supporting reports for other enhanced services across the country, because even though you might not get paid for a certain activity, it's still useful for you to be able to run searches to see how much that activity you're doing monthly. So I've just highlighted the wound care supporting reports there. So as long as your nurses are using that wound care template, you can be really confident that the figures being brought through by the supporting clinical reports are accurate. And you can just right-click and run these. You can break them down just as you normally would do for any report that you might have added yourself. Good. That hopefully covers, in a nutshell, really, the local enhanced service templates. It's an ongoing localization exercise as well, so you start to see that develop over time. For any of you that have already activated it, you'll start to see those templates pop up over time. The next little section here is just to cover some of the administrative tools as well. So talking the tools that we've designed for your reception teams, your back office teams, there's an awful lot of templates that we've designed for those users, and it's really just an opportunity to perhaps improve a process that's being captured by the front desk or the back office. But there's by no means any sort of mandatory requirements to use any of these if you've got effective ways of using those in practice. You may just want to introduce them slowly, but they can really help to improve your record keeping. They're great for CQC as well because they promote sort of robust record keeping within the patient's journal. Now, using this test patient again as our example, I've just got a button on my toolbar here that's labeled reception and administration. It's a little gold bell as the icon. As part of the setup guide, we just advise that you put that on your toolbar, certainly for all of your reception and admin teams. What a lot of surgeries decide to do is just to put that on one toolbar and everybody uses the same toolbar, but completely up to you. We don't physically touch your toolbars or your clinical trees. You still have full control over all of those. It's just a really handy button to use as a dashboard again for all of your reception and admin teams. Now, if I click on there, up comes our reception and administration template. And there's Lots and lots of features on here. There's usually not one person in the practice that uses every single one of those buttons, but it serves as quite a nice way of exploring the toolkit and finding out what other tools are available to you. Just to highlight a few sort of key features on here. The first section there, Encounter, this is just your way of documenting a note into the patient's journal. We tend to find lots of surgeries use this Note button that I've also got on my toolbar here, referred to as the Quick Note in SystmOne, which is just a really basic feature. It's just a line of text that goes into your journal. By stopping using that note box and using the reception admin template, it means that you read code all of these entries. So for example, if I type into the telephone box, that's automatically going to recode it as a telephone encounter. And I can type into these boxes, so spoke to patients on the phone. But actually, because the box is got a subheading there of telephone, I don't have to type the start of that sentence. It's logged as a telephone encounter in the record. You don't have to type that bit there, spoke to the patient on the phone. And actually, even better than that, there's a notepad icon next to each one of these free text areas, and these carry common lines of text, just like a consultation templates did, that I can select from rather than typing. So really common one there, telephone, no answer, message left on answer machine. It says I select it from a list and stamp the record of that information rather than typing it every single time. Now, if I just OK the template, just to show you what that looks like in the record, you can see here, obviously I've still got my consultation that I did previously, but that's the entry that I'd be expecting to see. So you get the little icon there, so it stands out in the record. You get that heading, reception administration, little subheading there for telephone, and then the message you've either selected or that you've typed in free text. The same goes for any face-to-face encounter, anything over email, fax, letter, anything to do with referrals. Sorts of things like test results on here. You can actually reference the test results in the record. So when it comes to giving out normal results out over the phone, to check those, I can just click the phlebotomy button, and this gives me a window into the record. So it means I don't have to go over into my clinical tree and access that information from the pathology and radiology screen. Good thing about going in through that route rather than pathology and radiology is if we're in the scenario like we are here, that there are no results available yet to give the patient, i.e. they haven't come back yet, when I come out of there, I can then just drop on a little free text comment or select from the preset notes there that no results are available yet, and patient informed to phone back. If I've given some but not able to give all of them, it's not all are back, I can stamp the record with that little bit of information, say only some results are given, patient informed to phone back for other results, which we tend to find isn't information that practices routinely put onto the records, but actually takes no more time at all if I'm using this method to check whether the results are back yet. It's just another couple of clicks, and you're putting in a really useful bit of information into the journal. A couple of other things you've got on here. You can essentially do anything in terms of updates to the patient's record through this one screen. So you've got really simple tools, things like patient contact details. I click on there. I can do all sorts for changing the patient's name, changing their address, changing their telephone number, doing their text message and email consent. I can also update their sharing preferences, register them for online services, record key codes for entry to their property. So it serves as kind of, I can do lots to do with the patient contact details all from one screen. It actually promotes slight sort of process changes in practice. So I've had conversations with lots of practices sort of over the years going out and doing the training, but when a patient comes up to the front desk to say, I've recently changed address, some practices will just change the address there and then. Others will give the patient a little slip of paper to write the address on. It goes into sort of an admin process that somebody does at various points in the week. But whatever you do, this template just sort of allows you to sort of reconsider that process. So, for example, if I get a patient coming up to the front desk telling me that they've changed address, instead of just changing that address, I can use that as an opportunity to make sure that all of their contact details are current and up to date. And there's a little form on here that I can print off for the patient. So this just works just like a letter. I can click on it, press write now, and print this off and hand it to the patient. The idea is that it will list all of the current information that you hold for the patient. So their telephone numbers, who the next of kin is, their carer information, and it gives it a space to type in the new details. So I suppose what I'm trying to get at is that if a patient's changing address, they may just assume that you're holding the right telephone number for them, and you can use this as an opportunity to get the patient to double check that information. But then you can also use it as a good opportunity to update their text and email consents, any other changes. There's a little signature sheet down there that you get the patient to sign it, and it can be scanned onto the record, for example. So Again, certainly not mandatory. We're not saying you have to change those processes in practice, but the templates kind of allow you just to review those processes and improve them if you think that that's an improvement. Good. So skipping over a few on here, we won't go through every single one of the links. So for example, things like a DNA template. The DNAs tend to automatically get coded into the records, but if patients are frequently DNAing, you have to prove the fact that you've given them fair warning in order to remove them from your list if they're frequent DNAer. So here it just takes the thinking out of the wording of the letters. Here I've got a DNA letter, that's maybe for the first DNA. I've then got a DNA warning letter, so that the patient's done it again or a few times, and then I've got my removal letter, so that's the final letter. So I'll say to the patient that we've written to you a couple of times about this, and now that we've removed you from the list. And I'll just show you one example of that. I'll show you the DNA warning letter. It's going to be along very similar lines to letters that you've maybe already got in practice, but it takes the thinking out of creating these. You don't have to worry about the wording. We keep these up to date, give you a whole good library of all of them. And there's our example letter there. Same sorts of things for the equivalent for child. So if like a DNA child there, different letters sort of addressed to the parents and guardian of, and a bit more information around sort of considering a safeguarding and a risk. So what a moderate risk or a high risk patient is. So moderate risk, for example, missed 2 or more consecutive appointments, there's a known safeguarding concerns or alerts, or there's any ongoing medical or mental health conditions. And here you can sort of do a bit of safety netting to say, I've discussed it with my clinical supervisor for safeguarding, and log that all into the patient's record. One or two key ones here. It's going to pop up the death documentation template. This is quite a key one that GPs tend to like because it can go a very long way to almost automating your CREM forms. So instead of handwriting your CREM forms, you can use an electronic version of it here. You can basically treat it as kind of like a letter where SystmOne will merge all the relevant information into the form for the GP rather than having to handwrite it. So for example here, I could say a patient died, say yesterday, time of death, who had been informed by, place of death. You get the general idea. It's a nice simple pro forma for your reception or your admin teams to follow. Serves as a prompt sheet for the questions to ask as well, because we need to capture all of that information before we can do the CREM form. We can then use the template to say I've informed the doctor, and I can send a task, a notification, or book a home visit, depending on how you work at the moment. Now here, I would then OK that template. You can see everything that I'm putting in through the templates is just nice and neat in the journal. So when the GP gets that notification that the patient's passed away and a CREM form needs doing, they reference the journal, nice and easy to read. And when they come into the template, they can then just go ahead and they can go ahead and do their part. So when they come into the same template, they can fill in their Med A's been signed, what the cause of death was, CREM form's been done. And then when they click on the new CREM form button, all of that information that's been captured into the template just merges through into the right area of the form. There we go. So just an example, the date, the time, and the place that the patient died. That can then be printed off and taken as kind of a pre-completed version, taken to the body, and then the GP can fill in any last bits that they need to while they're there, and then and sign it. You can also go ahead and sort of do the next step, whereas actually you can send the part 2 over to your neighbouring practice. So some of our practices do, they send a pre-completed part 2 over to the neighbouring practice that they can print, and of course, as long as they're happy with all of that information on there, when they take it to the body, they can sign it and update it. So that's death documentation. Another just really quick one, things like lab and radiology results. So this is a nice simple template to capture when a lab rings through an urgent result. So of course these results are going to arrive into the system electronically eventually, but this is the lab giving you the early heads up because it's significant. So we find that practices treat that in lots of different ways, and it's very typically a task. But the time-consuming part about that is that you have to type in what all of these blood results are. If you're anything like me, awful at spelling, that's the thing that takes the time. So the template just eliminates that, really. You can just type the values into the box. I'll just make some up here, put some in. You can then also complete the little section to the side. So, you know, where the results are from, I'll make something up here, Norwich lab, for example, but if you link to more than one lab, you can put a comment in there. You can also then tick a box to say that you've checked those results, you've read them back over the phone, so you're confident you've got them and they're accurate, and that you've informed the clinician. And then you can send them an instant message or a task, or what some surgeries do is book an appointment onto the duty doctor's triage list. But whatever you do after that and inform the clinician, you've got your quick link onto there. If you are sending a task, again, you don't have to type in what the blood results are because they're in the journal. You just put a comment in there to say, urgent results, see journal, and the GPs will know to look in there. And like all of this, if I just okay that, go into the journal, like everything that we're recording here is just nice and neat and really easy to read in the record. And actually a much better place to store that information rather than just in a task, because it's quite significant, that urgent result being phoned through ahead of the electronic result coming through. Good. Just maybe one or two more. The ambulance and transport. So if you're doing any transport booking, you've got a nice detailed form to put in all of the details. But actually just a 999 for a patient. If you've requested an ambulance for a patient, you can tick to code that. You can pop in a reference number, an advice and advice and wait time. If I click OK, again, like all of this, just nice and neat in the journal there. Just a good way of documenting it all. And there's a couple of nice points of reference on here as well. So prescription charges. Quite useful one. So it's just information. If you ever get that scenario, a patient comes up to the front desk asking, am I entitled to exemption for paying for my prescriptions, and you're not quite sure which conditions qualify a patient for that, you can just dip into this template and you've got that guidance. You can also tick a box to say that you've advised the patient to apply for free prescriptions. We've heard of a couple of scenarios where patients are maybe, challenging whether they've ever been told by the GP practice whether that they can claim for free prescriptions, and sometimes we've heard of scenarios where patients get a little bit upset and ask for reimbursement from the practice because it's their responsibility to let them know. And this is just a nice way that if you have given that advice to a patient, you can drop a code in there, drop a little comment, and then you've got that robust audit to fall back on as well. And then the lower half of the template is just links back to all your standard screens. So booking appointments, home visits, searching for free slots, sending instant messages, tasks, notifications, and also just a quick way of sending an email or a text message to the patient as well, ad hoc. Great. So that's hopefully a bit of an overview of some of the administrative tools that we've got. And just the last couple of subjects to cover, just sort of finishing up on the reports. So I sort of lumped these two together. You've got the contract and activity reports. We did cover that when I talked about the local enhanced service templates, but I'll just recap there. And then some of our other really useful reports for maximizing your QOF income. So again, back into SystmOne. I'm going to come out of this patient record now. We're looking at the reporting screen. So it's just a standard clinical reporting screen in SystmOne here. So I can click the reporting menu, clinical reporting. That's taken me back to where we were. So we were looking at the enhanced service returns reports for wound care. So just to recap, that's under the contracts folder. We've got current financial year. We've also got a separate folder for your CQRS returns. So anything pulled out automatically by CQRS, you've got a separate set of reports there. It's nice to have a heads up as to what's going to be pulled out automatically before that actually happens. So you can use those for your vaccination returns. And also your NHSE searches, so largely things like your SMI, your severe mental illness registers and codes there for reviews. So coming on to things like your missed income searches. Now, if I go into the contracts missed income folder, here you've got lots of different sub-categories, but largely the QOF one is the one that I'm going to concentrate on here. So these are kind of like your case finders, if you like, another way of explaining these searches. It's trying to identify cohorts of patients who are not on your disease registers, but that other things in the record suggest that they may need to be. So for example, a couple of nice straightforward examples here. Things like this one, query diabetes, is on repeat oral antidiabetics and no PCOS. So that's going to find a number of patients who are taking something like metformin. They're not on your diabetic registers currently, but they also don't have another qualifying diagnosis in the records to why they're taking that medication. So another reason they may be taking something like that is the PCOS diagnosis, polycystic ovary syndrome. So That will give you a number of patients. This is a test unit here, so I just get 0 patients for everything. But as soon as you activate Ardens, you can run those lists and start to get an idea as to how many patients you may be identifying. And it's not to immediately suggest that all of those patients found in the report need to be moved onto your diabetic register. Some may have a PCOS diagnosis, you just backdate that instead. But completing sort of either one of those 3 actions will clear that list down. So I could either add them to the diabetic register, I could stop their oral anti-diabetic medication, or I could code them with a PCOS diagnosis. And either of those 3 actions will remove the patient from that list. It has a direct effect on your income as well, because the more patients that you identify to put onto your disease registers, you increase your prevalence for your surgery and your pounds per point. So you not only get the opportunity to achieve more QOF points, but also the pounds per point, and actually what your points are worth, will increase as well if you have an increased prevalence on a disease register. It also is a safety netting point of view as well, because let's say you did find a couple of patients who are diabetic, but they weren't on your register. That would mean that there's an increased probability that you haven't scheduled care for that patient. So you may not have a recall date on that record. You may not be inviting the patient in for regular care and doing reviews when you should be doing. And lots of different examples of that. So, for example, things like your asthma sorts of inhalers. So things like query asthma, as you've got an asthma resolved patient, but they've actually had a repeat inhaler issued in the last year. So it's another sort of consideration. Do they need to get back on that asthma register, and so you schedule that regular care as well if they're still taking inhalers. A little bit lower on here, things like the osteoporosis ones are quite a useful set of searches to run, because they're, for want of a better word, the more lucrative areas of QOF. The points are worth an awful lot more than, say, something like hypertension. So here, things like query osteoporosis, as the patient has been coded with a fragility fracture, but no osteoporosis diagnosis. Also making a consideration for the medication they're taking as well. So if you are looking at increasing prevalence or looking for patients to add on to those registers, these reports can be a really nice way of doing it. We've also got other considerations, things like procedures, let's say. So for any of you that do minor surgery, looking at when procedures are possibly not coded. So looking at a patient that's had a local anesthetic used in the last year, but no minor surgery, injection, implant, or minor injury code has been added onto the record. So hopefully using those searches will just give you a really good way of maximizing the income for the practice. A lot of them don't rely on you using the actual Ardens template to support that. So those missed income QOF searches will be a useful exercise to complete at practice, even before you've got all of your clinicians using the Ardens data entry templates for those conditions. Great. Now we've pretty much come up to time now, so we're trying to get these webinars lasting sort of no longer than an hour. I think an hour is enough content for anybody to take on in one go. We've got a couple of minutes left, so I'm just going to highlight one other really key area of Ardens that we get a lot of feedback on, and that's just namely the end-of-life tools, end-of-life templates and formularies. So just another really key area that can immediately save your clinicians time is the end-of-life template. So here, if I go into my auto consultations list, Ardens consultations D to L, and select my end-of-life and palliative care, I've got a template that's designed along exactly the same lines as this doctor's bag template. So your GPs using that template should be quite at home with that layout, as long as they've got used to that standard sort of triage tool. And on here, the really key things on here is that I can update any things like patients' key messages, their treatment escalation plans, any of their future care planning information. So namely things like their DNA CPR status and their choices about their whether they receive things like oral antibiotics or IV antibiotics or any artificial feeding. But notably, the key area down here that the GP will get a lot of comments that GPs really like is the end-of-life formulary. So the formularies work in the same way as the asthma formulary, as the sore throat formulary that we looked at before, but with the added bonus of having the drug administration charts on here. So for example, if I go to the syringe driver and subcut starting doses section, I can use this as a quick way of generating the prescriptions. You may have a slightly different end-of-life formulary is the one that I'm accessing here. This is the national formulary, but this is an area that we localize for each CCG as well. We do that with your meds management teams. So I'm just dropping on a few prescriptions here just to demonstrate the way that this community drug chart works. So that's my prescriptions done. I can print the prescription, but here, just click on the community drug chart. Again, that's going to take me to the Wiltshire one here. So I'm just going to cheat slightly, and we're just going to swap over to one that's a little bit more relevant for you. Again, you don't have to complete this step to actually specifically select the Norfolk one. We do that configuration in the background, so you get directed to there straight away. If I load that up, again, SystmOne treats that as a mail merge document. So all of those medications that I've added onto the record will automatically merge into the right spaces of the form, and to save your clinicians having to, to hand write that information. So you can start to see down here, it's pre-populated the form with the medications and the doses that I've selected. Of course, I can then print that off, and as long as it's accepted in your area, if any of this needs to be in colour, as long as you've got colour printers available to you in practice, you can then just print that off, and you have that added bonus of this being stored in the patient record as an audit for every drug administration chart that's been edited, been changed, been saved onto the records. Great, so I think that kind of brings us to the end of that content. Hopefully it gives you a good idea as to what's coming, what's available to you if any of you haven't activated it. Any of you that have got that switched on, hopefully it's highlighted one or two tools that you weren't aware of, and you can start using those. For any of you that haven't activated the toolkit yet, the easiest way of doing that is just to pop onto our main website. We've got a link on here of this introduction webinar article that we sent you a link to. But essentially our website is just www.ardens.org.uk, and there's a button on the front page for start free trial. So if you click on there, you just input your practice details, and as soon as you've filled that in, you just let us know whether you're a SystmOne or an EMIS web practice. Agree to the terms and conditions there. You can reference them here. Click on submit, and that then alerts our team that then send you out all the setup instructions and for your SystmOne users, the tasks that you need to action in order to activate Ardens. It's as simple as that. Your CCG training team will be contacting you in due course as well. So we're going to be completing some super user training at the beginning of next month. And after that, your CCG training team will be contacting you to arrange some on-site training to help you get started and show you some of the tools in a bit more detail than I have done this afternoon. Now, unfortunately, this is a bit of a one-way communication. You can hear me, but I can't hear you. Essentially, everybody's muted because we do get a lot of background noise when there's so many people on the call. But you should see a chat feature at the top of your webinar controls. There's some green circles with some icons in there. One of them looks like a little chat bubble. Actually, if you hover over them, it'll give you a description. But that opens up a text chat feature. So if you wanted to drop any comments or any specific questions that you had in there, I'll hang on for a good few minutes here just to make sure that I can field as many of those as possible. But failing that, if you think of anything afterwards, you can just use the contact form on our website. There's a little contact option just at the top of our website there. Just a nice straightforward form that you can drop in there, just hit submit. That goes through to our head office, and then we'll make sure that the right person from any one of our teams gets back to you to answer your questions. Great, so if nobody's got any questions, feel free just to end the call there. Just click the cross at the top right-hand corner of your webinar controls, and that will just exit the webinar. But I will hang on for a few minutes just in case any of you've got any questions you want to drop them in on the text chat. Great. Hi there, everyone. I've just got a question through here. First of all, thanks to Ellie there. It's a really nice positive comment there. Saying it's going to be extremely helpful for everybody. So no problem at all, and thanks for your time this afternoon. So a couple of questions around long-term conditions and activating recalls. So as part of sort of getting used to the initial toolkit, so what I've covered what we would sort of consider as sort of getting sort of the basics out of the way, the day-to-day sort of running of the system out the way, getting everybody used to that first. Then we actually have quite a comprehensive annual long-term condition review set of tools available in the toolkit as well, and we can tackle this as a separate subject. So this involves a much more efficient way of getting your invitations out to patients and doing more of what I kind of think of as like a year of care review. So instead of having a recall on the record for asthma and then having a separate date for diabetes, you have you invite all of your patients in around their month of birth and you get everything done in one go. It's much better for you as a practice, saves you time, but also much better for the patient. They don't have to come back a few times a year for it. So just give you just a bit of a run through as to how that works, if any of you are interested here. Starts off really with the invitation reports. So if I go back into my clinical reporting screen here, I have then got invitations, LTC reviews. And here, if I go to the current year, you can see we've got a whole series of reports just arranged by a month of birth, really. So our way of splitting the work out throughout the year is just to identify any patients that have a long-term condition or any combination of long-term conditions, and we then arrange them into months of birth folders here that you can just run to send the invitation letters out. We've got an example letter that you can use, but essentially you can use any of your own letters. You can send emails and text messages. You can see we break down the list of patients down by available contact methods and preferred contact methods as well. And from there, all you do is you right-click, let's say the post group actions, and then print integrated word letters. That sends out a letter to everybody. I then add in a read code just to tell that report that I've communicated with the patient. So as a second action, bulk action, I just add that read code in bulk, that XABEF, which is like a first communication sent. Don't just do that with the bulk actions, add read code. So from there, my patient gets my letter, the text message, the email, telling them that they need to book in for their long-term condition review. And from then on, everything is controlled with one single template in the SystmOne record. So it's the second icon in under the name. You've then got a tab for each team that are involved in that process. So first of all, if I go to invitations, just tell me the month for annual review for this patient. It tells me when they had their last review and a history of all of the invitations we've sent them. I can actually send ad hoc invitations here, and I can actually override their month of review as well. If a patient doesn't want to come in the month that they were born, I can just click here. I can override that to a different month. From there, there's then the bookings tab. So for any of your reception team and the patient rings up to say, I want to book my appointment, they can click on the bookings tab. This gives me a detailed list of everything I should need to know, in order to book the relevant appointment with the right person. So here it tells me that blood tests are required, any other tests, gives me an idea of the length and the number of appointments that I need to book and the conditions that the patient's booking in for. Then here, I can use the free slot functionality within SystmOne to then go and book the patient the appointment. I can either do that manually through the appointment ledger, or actually free slot presets here is a great way of presetting the system to search for an appropriate appointment. And this is really especially useful where you've got varying lengths. So here, if I was to select that 40-minute appointment there, that would automatically show me the next appointment with the right long-term condition nurses, where there are 4 10-minute appointments that I can stick together to get my 40 minutes. Works really, really well. So it saves your reception team an awful lot of hunting around on the appointment screen. When the patient then has that appointment, the next stage is that, say, your HCA might go in there to do the blood tests. So they would work from this screen, initial review and tests. Again, it shows me an overview of the conditions this patient has, gives me a detailed list of the blood tests that are required for that patient. That's all of the blood tests. There's very complex clinical reports working in the background there to trigger the alerts for the blood tests based on the conditions that they've got coded in the record already, but also the medications that they're taking as well. So it eliminates that scenario that you get where you do most of the blood tests and the patient has to come back a couple of weeks later when they have their med review. Then have a detailed work to-do list down here. So this is, again, working on lots of clinical reports in the background, triggering the work that needs to be recorded on this record. So just to give you an example, let's say the wellbeing information, the smoking, I click on the wellbeing review, and all of my relevant templates down the right-hand side to go and gather all that information. A few that are grayed out here, that's because the patient's not diagnosed with that condition. So it really gives me a good idea as to what I actually need to fill out and what I don't. But here, let's go to wellbeing review. Now, ordinarily, if we're doing the full review, I'd fill in the entire template here, but just for the purposes of demonstration, I'm just going to satisfy that smoking status. So here, I'm going to drop in there, patient's a smoker, I'm going to say that I've given advice and I've signposted to a smoking cessation service. So as soon as I click OK, this work to-do list works in real time. So click OK there. It's actually warning me there that I need to do other things. I haven't completed the wellbeing review yet, but I'm just going to say no, I don't want to return to the template. It's a reminder rather than a mandatory field there, so it's telling me I should fill it in. It's not forcing me to. Then here, click OK, and that wellbeing work to do item has then disappeared for smoking. So again, you get that real-time validation. You've done the right thing, just like the meds optimization alerts, the safety alerts that we saw when we looked at the formulary for the sore throat formulary back at the start of the webinar. If I'm the HCA doing that, I can then tick the box to say that the initial assessment has been done, and that adds the patient to a work list where the initial assessment's been done, i.e. the blood tests, but the full review hasn't been done. And the opportunity here is to upskill your HCAs that are doing the blood tests to actually do a lot of the data gathering and ask the questions about things like the 3 RCP questions for asthma, and actually upskill them to doing things like, diabetes foot screening and things. When it comes to the full review, whether that's the nurse seeing the patient face-to-face, or what we like to think is that if the HCA is doing a lot of this work, that actually the full review could just be a notes review with your specialist nurse. They review what the HCA has done, review the blood tests, and then they make that decision about whether the patient actually needs to come back into practice or not. So they work from this list, which is a little bit more detailed. You've got things like your medication alerts and things like that on there for the drug reviews that would be done at that point and wouldn't be done by the HCA. But then I've got some series of options down the right-hand side, and one of these is patient follow-up. So the idea is if I'm doing a notes review, the patient's not actually there. For the scenario where a patient's very well controlled and I'm actually just telling them everything's okay, I've reauthorized your meds, we'll see you next year, I can just click on patient follow-up, I can select no follow-up, and then I can choose to send an email, a text message, a letter, or a task to admin to tell the patient that.
Sorry, I don't know that one.
Apologies, it's my Alexa kicking in. Now, coming to the other side of that scenario, if that patient does need to come back into practice, again, I just do the same thing. I click on patient follow-up. I can then click on a phone call follow-up or face-to-face, and I get my same options there. I can send an email, a text message, or a task to admin to go and let the patient know that. And there's some preset text there that I can copy and paste into a text message or an email there. Essentially, when I'm finished with that patient, I'm satisfied everything's up to date for that year. Instead of adding relevant recalls on for all their different conditions, I just tick the box so the annual LTC review has been completed, and that schedules in the review for next year. For any patients that need to come in sort of incrementally, like let's say a diabetic patient needs an HbA1c every 6 months, you use the annual review as a way of letting them know that for the first time. So you issue them with a care plan, which tells them they need to book in for their HbA1c in 6 months. And then you have some catch-up reports back in the clinical reporting screen here. So I can say here for interim review, and this shows things like for diabetes 6-monthly review. That's where an HbA1c is required, but that patient hasn't had one in the last 7 months. So use that as a catch-up search. You assume that you're telling the patient they need to come in 6 months, you're giving them that care plan, so you hope that they book that in, they schedule that in themselves. And for the patients that don't, you then do that catch-up report, and then you give them that reminder. And the same thing there for CKD, the various stages. So for sort of 3, 4, and 6 month interim reviews. If you're not using that system straight away, obviously it's a nice streamlined system. It works really, really well. I've had some great feedback from practices that are using that, but it is quite an undertaking, to change all of your recall system in practice. So if you're still using your traditional recalls in SystmOne, i.e. you're putting the dates on the records, but you want to use our long-term condition review templates, like I sort of demonstrated earlier, in order to put a recall onto a record, there's a little follow-up icon just to the right of the template. It's a little bit hidden, but you see those icons across a lot of the templates. So for example, if I go back to the doctor's bag, same idea there, you've got a little follow-up template. But what that does, it takes you to a screen where you can schedule that follow-up work. So it will show you any recalls, any future appointments. I can go and book the appointment. I could do a scheduled task. I could put a new recall on there. And I can just use that as a quick way of adding recalls. But essentially, it's still your recall list. We don't touch the list of available recalls that you've got available to you at your surgery at the moment. You still continue to use those. Great, so hopefully that answers those 2 questions there. So I had one for, will the LTC templates auto-populate for multiple conditions? So hopefully that covers that one. And also, how do you activate a recall was the other question we had on there. So I hope that covers both of those questions. Great. I'll hang on just for another few minutes just in case anybody wants to drop in any other questions into that text feature. But if not, thanks everybody for your time this afternoon, and please just let us know if you've got any questions about activating it, about how the training's going to work, or any sort of specific questions about why you're using it as well. There's a help and feedback link at the very top of every one of the Ardens templates. So if you have activated it and you're using it, if you just click the help and feedback link there, that will load up a web page, takes you to our, whoops, bear with me 1 second. So help and feedback at the top there takes you to our support website. It gives you help and support for what you're actually clicked through on. So I've clicked through on the general consultation screen there. There's a little YouTube video on how you can use that template. But then also there's a contact us form at the top. You can drop a question into there. We'll get back to you very, very quickly. Tend to get back to you within a couple of days, sometimes same day. And if it's an urgent query, if you need to speak to somebody, if it's urgent, then during office hours, so manned between 8:30 and 6:30 every day, that's our help desk line as well. Great. Just one more question there. Would a BP reading need to be inputted on 2+ templates? So no, it wouldn't. So as long as you've added it onto one template, it kind of satisfies all the criteria for the rest of the templates. But we have considered that. So when it comes to our annual long-term condition review template that we were looking through there, if I go into things like here, so you have a CVD initial review, which covers your blood pressure on here, and we try as much as possible not to duplicate those fields through any of the other initial review templates that you might see. So you tend to work your way through them, and you should only really see that field presenting itself once. If you weren't using that and you were doing something like, say, the hypertension review, and you put your blood pressure reading in there, and then you also then did say your diabetes review, and you had a blood pressure on there, I think actually we've considered, oh, there we go. So you've got a link to BP Pulse and CVD review there. So you shouldn't be feeling that you're needing to record it more than once. But if you do record it more than once, essentially it's not the end of the world because it's linked to the same read codes, so it's satisfying the same requirement. Great. So I think that brings us to the end of the questions then, unless anybody's got one more. I'll just hang on for one more minute. Okay, great. So no more questions coming through then. So thanks everybody for your time this afternoon. Yeah, please do just drop us a line if you've got any questions that you think of afterwards. We'll be posting a link to a recorded version of this webinar back on the web page that you had your instructions for joining as well. So if any of your colleagues couldn't make it, please do direct them to that. That'll be up there probably beginning of next week. So from Monday onwards, you'll be able to access that recording. Thanks very much.